Today we're going to talk about HPV basics and how it relates to dentistry. HPV is a common virus that causes cancers later in life. There are more than 42 million Americans infected with types of HPV that are known to cause disease. About 13 million Americans, including teens, become infected each year. Nearly everyone who is not vaccinated will get HPV at some point in our lives. The key is we actually can protect our children from these cancers via HPV vaccination. So we'll go a little bit over this. It's the number one sexually transmitted disease in America, which I think is something we need to be aware of. And the fact that everybody is going to be impacted by this at one point or another is also important. There are more than 200 related viruses of HPV types. For example, there's HPV 6 and 11, those cause skin warts, and there's HPV 16 and 18, which are actually cancerous. Those are 16 actually causes about 70% of the posterior oropharyngeal cancers that we see. One of the things that's important is a lot of people with good immune systems might be exposed to HPV, but will clear it within a period of a few years. So if a person tests positive for HPV, we can watch it over a period of time, and knowing the type is important. Is it something like 6 or 11 that might cause some skin warts or things of that sort, as opposed to those that cause cancer? So the types. HPV types are usually referred to as non-oncogenic. So those are things that we see in the mouth, like HPV 6 and 11, or oncogenic, the cancer-causing types that I think we're very familiar with from people we know in our families that have had cervical cancer, people we know in our families that have had posterior or pharyngeal cancer. 16, 18, 31, 33, and 42 are actually the ones that cause cancer and the ones that we're looking at a study right now. We have a very large trial. We're going to try to recruit 500 patients over a 2-year period of time, and we're looking at HPV, HIV, periodontal disease, and changes to the oral microbiome. And so we're going to check for persistence. Then we're going to actually check for oral lesions if they have them, which we're already doing. We're doing carrier probing on all of our patients because periodontitis is a key component of this. And then just to see if we type it, and if that type is persistent over a 6-month period of time, then we're going to actually do some biopsies. These are just some examples of oral warts that I see on a regular basis. Actually, if you look here on the date, it's 1998. So I have been treating and managing these for over 25 years, and they're not the easiest things to manage. It doesn't matter if you're Caucasian, African American, male, female, you're going to people do end up with these oral warts. They're cauliflower-like, they're raised, they're usually hyperkeratinized. The key is they're not innervated, so when I treat them, I don't really have to worry about getting the patient numb. So there's different ways of treating these. There's cryotherapy, which is what I use. There is surgical removal. The issue with surgical removal is that HPV-related oral warts or papillomas, or however you want to word it, they are recurrent. And so it's very important if you're going to cut something out and then it comes back, the patients aren't going to be very happy. So I use cryosurgery. It actually is very successful. I'll show a few examples of that. And there's the topical medications, including 5-FU. You can't use this inside the mouth, but you could use it for the lesion I showed previously on the corner of the mouth, or if there's some lip lesions, you can use it. It is a chemotherapeutic agent, so you need to be careful. One of the things that it also does do in your African American patient population, it will cause hyperpigmentation. So that's important, just to know that as a potential side effect. So here is cryosurge in action. This is a surgical cryosurge chip that I actually have my own now. Handle's a little bit long. You can see our high-speed evacuation there. This patient actually had several surgeries. They kept on recurring and contacted me. This is what it looks like when you leave. The key is, and it doesn't show in this picture, please make sure that the freezing part is off before you actually take the off the lesion because it might pull it off the lesion, and you don't want that to happen. This was a case that I had, very debilitating for this patient. You can see that their warts are everywhere. I did cryosurgery and was actually able to get the patient cleaned up. One recurrence, and that was due to a substance use issue. I went and told him that I would clean him up one more time, and that was it. And so we got him cleaned up again. He has been clean from illegal substances for 16 years now and leads his own group, and I'm very proud of him. So what about HPV and cancer? The International Agency for Research on Cancer found that 13 HPV types can cause cervical cancer, and at least one of those types cause cancers of the vulva, vagina, penis, anus, and certain head and neck cancers, specifically the oropharynx, which is the posterior part of the mouth. But I will say many of the cases that I have treated have showed up either on the lateral borders of the tongue or they show up on gingival tissue. And when we see something that's strange, of course, we're going to biopsy it, send it to the lab, and see what we're dealing with. And so I actually have had patients, regrettably just lost one, but for 12 years, he was able to enjoy quality of life because we had addressed his head and neck cancer. Most people who become infected with HPV don't know they have it. And usually the body's immune system will get, as I mentioned earlier, will get rid of the HPV infection, which is true for both oncogenic and non-oncogenic type. By age 50, at least 4 out of 5 women will have been infected with HPV at some point in their lives. It's also very common in men and often doesn't have symptoms. Many people are exposed to, as I mentioned, oral HPV in their life. About 10% of men and 3.6% of women have oral HPV. So this is something we actually see more frequently in men than we do in women. Oral HPV infection is more common when you get older. As I said, most people will clear HPV within 1 to 2 years, but HPV infection persists in some people. So for our study, we need to have 2 positives, one and then on visit 1, and then see if it persists on visit 6, at visit 2, which is 6 months later. If that is the case, then what we're going to do is actually do a typing to see what it is, do the biopsy at that point, see where we're at, and inform the patient on what we're looking at. But to do an HPV over-the-counter test and find out that you might have an oncogenic type is not something that I actually recommend. HPV can infect the mouth, as I mentioned, and the throat. It takes years after being infected with HPV for cancers to develop. HPV is thought to cause 60 to 70% of oropharyngeal cancers in the United States. So for years, when we thought about oral or posterior oropharyngeal cancer, the number one leading cause was smoking and drinking. That is no longer the case. HPV is now the number one cause of posterior oropharyngeal cancer. And the only good thing I can say about this is HPV-induced cancer responds much better to treatment than people who get cancer based on smoking and drinking. Of course, if you have a combination of HPV and smoking and drinking, it does sort of make the issues a little bit worse. So, as I said, it causes many different kinds of cancer. More than 37,000 people get HPV-related cancers in the United States every year. Remember, this is a cancer we can now prevent. So the vaccinations that I'm going to talk about, they can prevent more than 90% of HPV infections when given at the recommended ages. So you have 37,000 cases of HPV-related cancer in the United States now. Wouldn't it be wonderful if we started vaccinating at a younger age and we no longer had any cancers related to HPV? That would be our goal. So if you look at CDC, top HPV-associated cancer is now oropharyngeal. It causes squamous cell carcinoma. You look at a CDC, they looked at this from 1999 to 2015. And what happened was because you used to think that HPV-related cancers, the number one were in the cervix, were in women, but that has not happened. Cervical carcinoma incident rates decreased 1.6% per year. And oropharyngeal squamous cell incidence rate increased by 2.7% per year among men and 0.8% per year in women. So again, you see, this is something that impacts men more than women. So when we're talking about vaccinating our children, we both need to vaccinate men and our young boys and young girls. The uptick in squamous cell carcinoma could be due in part to changing sexual behaviors, including having unprotected oral sex, especially among Caucasian males who report the highest number of sexual partners in performing oral sex at a younger age compared with other racial or ethnic groups. So when we talk about vaccination, it can be started at age 9. It really is recommended for 11 or 12, but it can be done through age 26 for those who weren't vaccinated earlier. So CDC recommends HPV vaccination for children at ages 11 or 12. Remember, you can start at 9 to protect against HPV infections that can cause cancers later in life. More than 15 years of data show that HPV vaccination provides safe, effective, and long-lasting protection against cancers. Research shows that healthcare professionals are parents' most trusted source about information on HPV vaccine, and that includes us, the dental profession. Whether you're a dental hygienist, dental assistant, you're the dentist, being knowledgeable about this and being able to talk to parents is really very important. We are more than just tooth plumbers. We are a part of primary care and look at the overall health care. HPV vaccination prevents new HPV infections, but does not treat existing HPV infections. It works best when it's given before any exposure. As I just mentioned, it's routine vaccinations to start at 11 or 12 years old, but it can be started at age 9. It also recommends vaccination for everyone through age 26 years, if not adequately vaccinated. When younger, it's given as a series of 2 or 3 doses, depending on the age of initiation or even immunological status. Children ages 11 to 12 should get 2 doses, 6 to 12 months apart. However, if you get 2 doses and it was less than 5 months, you actually need a third dose. People aged 15 to 26-year-olds who start the series later in life need 3 doses of the HPV vaccine, and they're given over a 6-month period of time. So it could be teenage patients that aren't vaccinated. It could be pediatric patients that aren't vaccinated. We have a huge role in helping to prevent cancer of our patients, head and neck cancer of our patients. HPV vaccination works extremely well. The vaccine has the potential to prevent more than 90% of cancers caused by HPV. You also can look at the data. Fewer teens and young adults are getting genital warts. The vaccination has also reduced the number of cases of precancer of the cervix in young women. The protection provided by HPV vaccines lasts a long time. Up to the data we have is at least 12 years, and the protection against HPV remains high with no evidence of decreasing over time. The possible side effects. Most people, or many people, don't have any side effects at all. Some people have mild impacts by it, like a sore arm. You might get pain or redness or swelling in the arm, possibly getting fever, but they don't happen very often. Dizziness or fainting, and this is an important point. Fainting after any vaccine, including HPV vaccine, is more common amongst adolescents than adults. So if you're in a practice, like during COVID, we were actually able to vaccinate patients. If that comes around again, you would want your patients your adolescents seated in the dental chair when you give the shot, because there's a possibility they may fall out. There's also the possibility of headache, joint pain, feeling tired, and nausea. There is only one vaccine available for the most common strains in the United States, and that is Gardasil 9. And limited data indicate that vaccines against HPV decrease rates of HPV-associated oropharyngeal cancers, as is the case for cancers in other body parts. I have a few of the sources on this presentation. So what I want to really talk about is this is something that we can do to help make sure that HPV cancers are a thing of the past. So that could be talking to the parents when you have them in your chair. It could be talking to your parents when you have a pediatric patient in the chair. It's how you get this information across. It doesn't make people more likely to have some kind of increased sexual behavior. That is not the case. That it is safe, it's effective, and it's a way that we can prevent cancer and recognize HPV when it shows up in the mail. As always, thank you for your time and attention.